We are back on Morning Line. It's our final segment with Dr. Lloyda Williamson. She's over at Meharry Medical College, chairman of psychiatry department there at the university. It's good to have her with us this morning. As we went to the break, I just wanted to say this. You've probably encountered patients that have dealt with this one way or the other. We talked about how in certain cases, yes, medications may be required to help folks through a difficult time. But what about the problems with self-medicating? And of course, I'm referring potentially to illegal drugs, over-the-counter, medications maybe. And then, of course, liquor and whiskey, booze, and wine. What about the problems with that?
Right. So thank you for mentioning that. That is so important. It is true that people self-medicate very frequently, and that has been occurring on a regular basis during this pandemic. Alcohol is a frequent thing that people use to self-medicate. It's a temporary thing. The long-lasting use of alcohol in excess is that it's a depressant. So while it may temporarily help people to not think about their problems, it can make the depression worse. We are also continuing during this pandemic in an opiate crisis. And so we're also concerned about the increased use of different type of opiates in terms of pain medications and street drugs, heroin in particular. And so these can also cause more problems in terms of the mood and also subsequent death. Different states have different rules and laws about marijuana and cannabis. We do know that cannabis is frequently labeled or laced with other substances. And for people who have a tendency to have different psychiatric problems already, whether it's hearing voices, seeing things, depression, including anxiety, while it may treat the anxiety and help people to feel less worried or less stressed, it can make things worse. So instead of self-medicating, the thing to do is really seek treatment, talk to your provider, talk to your primary care doctor, and recognize that the self-medication is really putting a Band-Aid on the issue instead of dealing with the core underlying problem of depression and anxiety. We don't have any studies to show that using alcohol, using opiates, and using marijuana in the long term, being able to treat these emotional problems. They may temporarily help you feel good, but they're not going to make the situation better.
All right, so there are, of course, other things that perhaps are not as harmful that can make you feel good, and I want to talk a little bit about that. Many of us may diet one way or the other or try to watch what we eat. For me, come the holidays, I just love raspberry pie. And look, I don't eat it any other time during the year, but at the holidays, that's when I'm going to splurge. So, I'm not going to be drinking a bottle of whiskey, but I might eat a whole pie. Is that so bad? If it makes me feel better?
Well, I don't know your individual situation. Usually a whole pie at once is not the most nutritional thing.
Okay, I understand that.
It's got fruit in it, and it's got... Yeah. So maybe,
but it gives me these endorphins. It makes me feel better. I get endorphins, the rush from eating the pie. Maybe it's the sugar.
Yeah. I would redirect you to your primary care doctor, but usually that's not the best option. So yes, comfort food makes you feel good, but just doing everything in appropriate portions is going to be the best option.
Okay, we just have a couple of minutes left. I want to give you, I've been asking a lot of questions, any parting shots that you'd like to share with individuals as they approach the holidays, and we're in them now already. Just any other thoughts maybe that we haven't covered that people might want to consider as they deal with this, or something I haven't asked you?
Sure, and thank you. We've sort of been talking around it, but just recognizing that unusual or different feelings during this holiday season are to be expected. We are going through an unprecedented time with the pandemic and with the physical distancing. And so recognizing that is a first step. Being able to talk with somebody about it, and if it's mild transition, talking with a partner or a spouse or a friend, to be able to just verbalize and just acknowledge and share the difficulties. But then also don't just stay in that negative moment. Do some problem solving and see what you can do to shift things as best you can. There are some things that are out of our control. Don't focus on those things. Focus on what is in your control, your schedule, your eating habits, your sleeping habits. And then if things are really discouraging, seek help. There are apps on that are available to help you learn how to relax and calm, organize your day, and prioritize your schedule. And if it needs to be more, seek help. It's not a weakness. We do regular dental checks to prevent major problems in our mouth. And so that's a positive thing to go to the dentist. So our emotional health is just as important. Do regular things to take care of your mental and emotional health. And if it means seeking a counselor or a psychiatrist or a therapist, go ahead and do that. Because if you don't, things can get worse and there can be greater consequences that are more difficult to manage.
Exactly. Doctor, I really appreciate you joining us this morning. Thank you so much for coming on and sharing your thoughts with us. And
Thank you for having me.
My pleasure on this. And hopefully we'll talk again, all right? And you do please have a happy holiday.
All right, you too. Take care. Watch that pie.
I'll do my best. Thank you, ma'am. All right, we're going to take a break on that note. When we come back, I will wrap things up for you right after this.